And now we're going to get an initial reaction from a Republican member of the House of Representatives who is in a unique position to evaluate the plan. Illinois Representative Larry Bucshon is not only on the Health Subcommittee of the House Energy and Commerce Committee, he also is an experienced heart surgeon. He joins us now from Capitol Hill. Welcome, Representative Bucshon, Dr. Bucshon. It's great to have you with us.
Well, thanks for having me.
Before we get into this new bill that we've seen just a draft of now, we just saw from the president a new tweet talking about the fact that we're going to have a second and third phase of this repeal and reform effort on health care that will address questions of state lines with state insurance. Should we be expecting more? Is there more coming?
Well, this is going to be done through reconciliation here initially, and reconciliation is a specific process that only allows you to do things that have a direct budgetary impact. So that's what we're doing initially here. Then we're going to see some action, hopefully through the Department of Health and Human Services and Dr. Price, and then we're going to have to work further on legislative fixes to the Affordable Care Act, and we're going to have to get some bipartisan support to do that.
So, Representative, you mentioned reconciliation, and you understand it better than I, but my understanding is in order to do that, you can't have an effect on the amount of money going out of the U.S. Treasury in order to make it through reconciliation. There is not scoring on this new bill yet. When will we expect scoring? Do you have to have scoring before you know whether you support it?
Well, I don't initially going through the committee. You know, this Wednesday we're going to mark up the bill in the committee, but certainly we'll have to have the CBO score before we go to the House floor, because under reconciliation it has to have no budget impact or it has to save money for the federal budget, or else it doesn't meet the requirements of reconciliation. So we'll have to have a CBO score before it goes to the House floor, and I think it's imminent that we'll have a CBO score.
And do you have any expectation on that score, knowing healthcare the way you do?
Well, I think it's going to have no budget impact, or it's going to save money, because we've worked through this process really over the last, 6 years. And last year we ran on a Better Way plan that Speaker Ryan put together along with House Republicans. And we know that under reconciliation, it has to save money or have no budgetary impact, or else it can't go through. So I'm pretty confident. And, if the CBO comes back with a positive score, then we'll address that.
So assuming that you do make it through this scoring process and through reconciliation, what effect will this have on Americans and the number of Americans who have effective health insurance?
Well, I think ultimately, once we get through the whole process, we're hoping that more Americans are going to have insurance. You have to recognize that even under the Affordable Care Act, 26 or 28 million Americans still don't have insurance, and ones that do are seeing deductibles that are sky high and premiums that are going up rapidly on the exchanges. And I would argue if you have a $10,000 family deductible, if you're a middle-class family, is that really good health insurance? I would argue not. So once we get through all of the three portions of what we're trying to do here to get health care affordable for the American people, I'm pretty confident we'll accomplish that goal.
One of the things that the president has pointed out is that under Obamacare, there were real problems developing with the insurance system because, as I understand it, you had healthy people staying out of it. You had sick people in, and that really changes the insurance system. You're eliminating the individual mandate in this bill. Doesn't that indicate that actually it will put more pressure on health insurance companies?
Well, I don't think so. It's true. Under the Affordable Care Act, they predicted about 40% of people would be under the age of 35, and they've seen about 28%. And what that's done is driven costs up for everybody in the exchanges and made it impossible for the insurance companies to function within the exchanges. As you see, they're dropping out and prices are going up. Deductibles are up. What we want to do is unleash the American healthcare system so that we can get back to a more market-based system, actuarially sound, so the insurance companies can offer policies that people want to choose from, and that gives America choice. So I'm pretty confident that we'll have a lot of choices. There'll be policies that people want, rather than prescriptive policies that are coming out of Washington, D.C., as it is under the Affordable Care Act.
But what about lower income people? Because this really would have reform of Medicaid, as I understand it, phased in over a period of time. A lot of the people that came into health care insurance under Obamacare were through the Medicaid system. Are you concerned that those people will now be thrown back out?
No, they won't be, because, we have said, and we intend to keep our word to the American people, that we're not going to pull the rug out from under anyone. And so, under our initial plan here, the Medicaid expansion is still in place for people that are on the expansion, and we want to slowly work our way out of that back to where it's affordable for the states and back to where Medicaid covers people that need it. So, you know, as a physician, I don't want anyone to lose their health insurance, and our plan doesn't allow that to happen. And look, in Indiana, we have Healthy Indiana plan, which is part of the Medicaid expansion. I don't want those roughly 300,000 people to suddenly lose their health care. So we're working hard to make sure that doesn't happen, and I'm pretty confident that they won't.
Okay, many thanks to Congressman and Dr. Larry Bucshon. Thank you for being with us.
Welcome. Thank you.